Hey everyone, I'm Dr. Supriya, and in this video I'm going to discuss about detection of flagella in a particular bacteria. Whether a bacteria have flagella or not. Flagella is a very thin structure, and for detection of flagella we need a particular step. So flagella can be detected by direct method or indirect method. Okay. Direct method, we use Lifson's staining, that that is also called as Lifson's method, and in indirect method, and one more, electron microscopy. This is the direct method, Lifson's staining and electron microscopy. Okay. Now indirect method, we detect flagella by Craigie tube method, hanging drop method, mannitol motility, and dark ground microscopy. Okay, I will discuss all the steps how we can detect flagella in a flagellated bacteria one by one. But firstly, discuss Lifson's method. This is the direct method of flagellar detection. How we detect flagella through Lifson's staining or Lifson's method. So, at first, why we need detection of flagella? Because there are some pathogenic bacteria which possess flagella, and for and they give their biochemical test in a variable fashion. So their detection through biochemical method is difficult. So we go for flagellar detection to make a proper diagnosis. For example, H. pylori infection. If a patient with peptic ulcer came and consulted a doctor and their biopsy specimen reached to laboratory, then for confirmation of whether it is H. pylori infection or not, we need to demonstrate presence of flagella, because H. pylori is a flagellated bacteria, and H. pylori give their biochemical test in a very variable fashion. So for confirmation of for you can say confirmation of H. pylori infection, we need detection of flagella. So this is the so you can assess this is the use why we need Lifson staining, and why we use Lifson stain. Similarly, there are several flagellated bacteria, and H. pylori is a H. pylori infection is a clinical correlation. We can assess the use of Lifson staining in detection of H. pylori infection in peptic ulcer patient having peptic ulcer. So I have given the example of this. Now let's discuss the steps of Lifson staining. Firstly, we will go for the gross step of Lifson staining. Okay, and then we will discuss what is the theoretical point, what is the conceptual point related to every step. So let's discuss. Firstly, take a small colony of suspected bacterial culture and then add few drops of sterile distilled water. And after making a suspension, incubate this for 20 minutes. After incubation, use this suspension for making a smear. Now, what is the step of making a smear? Take a clean slide, add 1 to 2 drop of suspension and make the slide slant and allow the suspension to fall in his own way under the effect of gravity. Okay, then we will get a free flowing smear. A smear form as a result of free flow of that drop suspension, and allow it to get air dry. No heat fixation is needed. This is the gross step of Lifson staining. Now, how we will stain this smear? Lifson's stain consists tannic acid, basic fuchsin, and acid alcohol. Once we flood the smear with Lifson's stain, tannic acid get attached to the flagella. Okay, and then alcohol get evaporated and basic fuchsin stain the flagellar structure. Now, what is the effect of attachment of tannic acid? Tannic acid, after attaching with flagella, tannic acid make the flagellar structure more prominent or thick. Okay. After becoming thick, flagella will be easily visible for us, and so tannic acid make flagella thick, and this basic fuchsin stain the flagella. That's why we get a colored structure, a red color structure. So once we see this smear under microscope, then flagella appear very clearly visible thick structure and stain as a red colored thick structure. So this is the basic concept behind Lifson's stain, that after applying Lifson stain, we make the flagella thick and colored so that we can easily visualize this thin, delicate structure of black bacteria. Okay. Now, let's go for another method of flagellar detection. And another direct method of flagellar demonstration is observation under electron microscope. And under electron microscope, flagella will be visible as the image shown in this video. Okay. Now, next is indirect method for flagellar detection. Next is indirect method of flagellar demonstration. For this, we use Kriege tube method. How we will perform? In this method, we use a hollow tube having semi-solid culture media. Okay, and we also need a bigger test tube having culture media, semi-solid culture media, and then we place this small hollow tube, that is also called as Kriege tube. That's why this method is named as Kriege tube method. And we will place this Kriege tube inside the bigger test tube containing culture media. Okay, and then the bacteria that we need to test for their motility, that is presence of flagella, we will take a small colony and will inoculate that colony inside the Kriegi tube, which contain semi-solid media. Okay, and after inoculation, we will allow it for incubation at 37 degrees C for 24 hours. After 24 hours, we will observe for the result. That is, if bacteria will be non-motile, then will remain inside, will grow after incubation and will remain inside the Kriegi tube. And if bacteria will be motile, bacteria will have flagella, then it will move and will be motile and will go outside the Kriegi tube and will also grow in the surrounding culture media. This is the basic concept. Okay, clear? Now you can understand with the image. You can correlate my words with the image. Okay, now next indirect method of bacterial motility detection, that is the detection of flagella, is hanging drop method. What we will do in this method, as name indicate, hanging drop will be hanging, means लटकने वाला है ना, hanging drop method. In this method, we take a clean grease free slide, and we make a ring of paraffin wax, okay, and placed over the slide. Clear? And then we take a cover slip, clean grease free cover slip, and add a drop of bacterial suspension at the center of cover slip, and allow and make a circle around the cover slip with Vaseline, and place the slide where we kept that paraffin wax ring over the cover slip. After making a paraffin wax ring and placing a drop of bacterial suspension over cover slip and applying Vaseline, will place the slide over covered slip and then make it in front of you. Then we will find a slide, paraffin wax ring, and cover slip having that where we put a drop of bacterial suspension, that is at the top of slide. So what we find, a hanging drop, a drop which is hanging from the ceiling of cover slip, and then we will observe this hanging drop under the microscope, and where we will observe at the east of drop, where we can find a motile bacteria. Bacteria having motility will go at the east of drop because of surface tension, and where we can demonstrate motile bacteria under microscope. Clear? Now next method of flagellar demonstration is mannitol motility agar. In this method, we detect fermentation of mannitol, as well as we confirm the bacterial motility with presence of turbidity. Once mantol agar show turbidity, then we can say bacteria, that is testing bacteria, is motile. Okay, this is and this is all about the process we are doing for demonstration of flagella in a particular bacteria. Direct method, we do Lifson's method, Lifson's staining, and then electron microscopy. And indirect method, we perform Kriege tube method and hanging drop method and mantol motility. And next is dark ground microscopy. That is there is nothing for explanation. Mm, these are theoretical things. So I'm ending this video here. If you have any question, just ask. I'll try to explain. Okay? And continue studying. Okay? All the best. Thanks for watching.